Pushpak, Occupational Therapist from Bakenpet branch, and I'm introducing my colleague.
Hi, good afternoon. This is Anusha, a behavior therapist from Pinnacle facility.
So today I'm going to explain about hand stimming and self-stimulatory behaviors. So if I understand what is stimming. Stimming is something which the kid will do for repetitive movements or noises. There are different types of stimming like visual stims, vocal stims, auditory stims, and tactile stims, and something called as oral stims. So first we'll understand why the kid does stimming. Stimming is a different kind of repetitive movements or noises which the kid will do because of boredom or due to enjoyment or due to excitement which happens around him. He does it because the kid doesn't. Most of the autistic kids are generally non-verbal till most of the kids are non-verbal. 95% of kids, so they'll be not able to express whatever they're feeling. So due to that, the kid will be adopting some behaviors to express his happiness or excitement or whatever anxiety. So due to this, the kid will do this self-stimulatory behaviors, which is a normal thing. But most of the parents think that the kid is expressing it in a different way. But in my experience, what I learned is it's his way of expressing things, or like his way of expressing happiness or excitement or anxiety. So if a kid sees a bright light, for example, he sees a bright light and he jumps or he does hand clapping, so that's his way of expressing happiness. So instead of stopping the behavior, we can replace it. So most of the parents will say stop or like no. So I would say don't do like that. Instead of that, you can give a pop it toy or like fidget toys. There are a lot of fidget toys available on Amazon or like a lot of online stores or e-commerce stores in the toy stores. So you can get that. You can divert the kid. You can give a ball. So you assume a kid is doing hand clapping while observing a light. Okay, so it is not socially acceptable behavior according to our society. So what we should do? We should teach the kid whenever he is excited, we can ask him to press a smiley ball or a fidget toy, or we can ask him to pop it. So in this way, we are going to replace that behavior which is socially acceptable. So never ever tell your kid to stop that behavior. Instead of that, you tell him to replace or divert him so that it get replaced. As it took ages to develop to get that behavior, even it will take a certain amount of time to get to reduce it. So don't expect it will go in a day or two or within a week. As it took, if assume a kid is 5 years old and that behavior he has been adopting since 4 years. So if you expect it to go within a week or month, it doesn't really happen. Mostly, so if the kid is doing stimming at your home, so you should do more often at your home. Like whenever you observe, you give a ball, ask him to press it. So through practice, definitely the kid will be able to press the ball whenever he is happy. Or you can either tell him to put hands in his pocket, even that is a socially acceptable behavior. So in this way, instead of stopping the behavior, you replace the behavior. Never ever say no to your kids, divert that behavior. So some kids will do vocal stims. So why the kid does vocal stims? So he enjoys the sound whichever he is listening. So a kid with vocal stims will have more of auditory seeking. So he can listen to the minutest sounds like a refrigerator sound or even the sound of a computer processor. So those are the minutest sounds which we cannot hear. Normal human cannot hear. But a kid with auditory seeking will definitely have that good sensory auditory seeking. So the kid will listen to those sounds and he'll try to enjoy that. So his way of expressing his vocal senses, he'll do like that he'll do, or he'll try to hum. He'll hum more. So we shouldn't stop that behavior. We can replace it to something which is socially acceptable. Or what we do in OT is we'll just put some headphones, we'll put some calming sensory music, or for attention concentration in behavioral therapy, they'll put om sound so that the kid will get calmed down. Also, some research even proves that if we put om sound and all, the attention concentration gets improved and the kid senses will get calmed down. Even with calming music sense also, we'll do heavy activities like pushing or pulling activities. We'll ask the kid to do climbing and getting down the ladder, and we'll do a lot of proprioceptive techniques to reduce this auditory input. If you do heavy activities, then this auditory sensitivity will come down. So even some kids do fidgeting. So a lot of parents have asked me why my kid does fidgeting. So few of my parents asked like, okay, my kid is playing with the rope every time or with the thread. So they feel that that's like a tactile issue. I would rather say it's not a tactile issue, it's like behavior. He just wants to play with the toy. So whenever he is idle, see why most of the special kids will stim, because a kid is idle. So even if I will be idle, I will not, my mind will be not that, my mind will become less active. So to stimulate my mind, I'll just go through Netflix or something. I'll enjoy that to pass my time. But a special kid doesn't have something like that to do. So what he'll do to stimulate his mind, he'll just visit. Okay, he'll take a toy, he'll try to do like this. What this input gives him self-stimulatory behavior, so that he'll be regulate himself. Because of that, he'll be able to pass his idle time. It's not like that he is doing more often. So make him engage in something or the other, so he'll stop visiting. He'll not completely stop, it can be reduced up to some extent only. Don't expect your kid to stop visiting for the for the rest of his life. So replace it with something which is socially acceptable. So most of the parents ask it should be gone for 100%. See, I cannot make fake promises like that. Like, see, your kid doesn't visit for like his life. So mostly ASD kids and ADHD kids, they'll visit up to some extent. We can reduce, but not up to that extent like 100%. We can just reduce it up to 90% mostly. The 10% will be there, which is like you can just ignore that. Like I would say, don't even bother about it. Even there are certain stims called oral stims. So most of the kids will do put the objects in his mouth, or they'll try to chew whatever is there around them. So for that, most of my parents have asked like what we should do. So we can give them things called jewelry. So if a kid is having oral sensitivity or something like that, so first we should check what is oral sensitivity. So we should check with very hot water, not very like lukewarm water or ice water. So we should check it. So if a kid is reacting to that, then your kid is having oral sensitivity. For that, we'll just give cotton balls, dip cotton balls in hot water, and we'll do gum massage with teeth. And along with that, we'll do with cold water as well. So due to this, his sensitivity will come down. So even the sensory system gets calmed down, he'll have some sensory needs. See, in my experience, what I have learned is, most of the kids, even if we give sensory input for the entire year and you are not giving for the next day, it's like how food is like for us. It's like sensory, we call it as sensory diet. So if a kid wants to jump, let him jump for meaningful jumps for 10 counts. Make him stop. You put a timer, you ask him to jump for 10 minutes, then stop. Or like they jump for 10 counts and then stop. You put a timer, and after the timer rings, he should stop. So you give him a certain time to jump. That's called sensory break. And for us, like food, for them it's like sensory diet. So if you can't control the kid every time, like don't jump, how many times you'll say? It would look awkward in public. So instead of that, before taking a kid, if a kid is hyperactive and you want to take him to a mall, okay, you give all the sensory input which he wants. Like if he wants to jump, let him jump for 10 minutes before going to mall. So definitely your kid sensory system will get calmed down. Then your kid will be behaving in a good way in the mall. So you can't control the kid every time. Don't expect him to be a robot. So treat him like a kid and accept him. And in oral sensitivity, the kid will have a lot of oral stims. So for that, we can go with jewelry. So there are a lot of jewelry toys also available on Amazon or Flipkart. So in that, you can just order it, and you can give, instead of putting everything, you just give the jewelry thing, like the toy, and ask him to chew it. You can't stop it entirely. That sensory get reduced, but whenever he needs, instead of putting something or the other, like kid will get affected, his cells will get affected if you put something in which is on the ground or something. So teach him, you can put the jewelry around his neck, so that whenever that oral stimulation is coming, he'll try to chew that. As it took years to develop, even it will take some time to adapt to that. So most of the parents will try for a day or two, or within a weekend they will say that it's not working. I wouldn't say they should do like that. they should try at least for 1 or 2 months. Then definitely you'll see change in the kid. I mean, like, he'll start eating with the children more rather than this toys. You should put it around his neck, so that whenever he has a sensation, he'll adopt that. You should spend some amount of time with the kid. So whenever he is having that sensation, try to observe. Whenever you have time, you observe that, and you give the jewelry. Definitely your kid will be adapted to chewing that whatever jewelry toy which you are giving, rather than the objects or unhealthy things which are around him. The rest is like tactile stim. So most of the parents complain me that my kid is hugging, my kid is touching ears. Okay, so touching ears, I really doesn't, I mean, like, take as a tactile thing. It mostly, some kids will imitate. See, I'll pinch someone's ear, so he might be imitating that. So we should find the root cause, rather it is a tactile or like a normal, like he learned from someone. So most of the parents tell me that, like, this is a tactile thing, but I won't agree with that. When a kid is having tactile sensitivity or something like that, he'll try to avoid the touch. Like, it can be over-seeking or under-seeking. If it's over-seeking, he'll try to touch more, only a particular texture, not of all textures, only a particular texture. But under-seeking means, like, the kid will avoid, like, generally the kid will do toe walking, or like he'll not walk on sand or grass or water. He'll try to avoid like textures. So for that, we'll give different activities. We'll do Wilbager protocol, which is done for 2 to 3 minutes. Along with that, we'll give joint compressions, which will reduce the tactile sensitivity, which has been introduced by Wilbager Patricia. So it's coined on her name. That term is coined in her name. So this gives a very good result, which I have used on my kids, and a lot of my kids have reduced the tactile sensitivity. And there is something called as tactile defensiveness, like, which is called as under-seeking. So kid will avoid the structures. If you do for this, and if we make the kid walk on grass and sand or water, the kid will be able to adapt to the textures, and he'll not avoid those. We can't say he'll completely walk on that grass, but 80 to 90% he'll definitely walk on that, and he'll feel good. So I have seen very good improvements in my kids, which I have done Wilbager protocol and that introducing those textures. And some parents even complain about proprioceptive things, like, my kid is hugging everyone. So he's seeking more of touching textures. He's rubbing his back on his walls, or touching his body to the walls, or like to other persons. So it's more of tactile, like proprioceptive. So for that, you can do bedsheet rolling, and whoever kid is doing the proprioceptive stims, we should ask the parents to avoid those hugs. Instead of normal hug, you give bare hugs or tight hugs. So due to that, your kid will get that proprioceptive input more, and that overload which is coming, it will get reduced. Sensory overload which is coming, it will get reduced. So we should avoid hugs for those kids. We should give bedsheet rolling with compressions, along with visible compressions. And we can make him do a lot of proprioceptive activities like animal crawl, bear walk, knee walk, duck walk. We can make him climb on ladders, and we can make him do pushing and pulling activities. So through that, the proprioceptive input, which the need is that we are trying to give that. Whatever treatment we do in Pinnacle, or like any occupational therapist, which they do, is called as a sensory diet. So most of the parents will tell, my kid is behaving good in center and not behaving good at home. So why the kid will behave good at center and why he is not being good at home means, see, we give sensory input or sensory diet, whichever he is needing. So the kid will get calmed down. So we are calming down his senses. So we ask the parents to just spend their whatever feasible time they have. So they should be able to try to practice it. So that whatever sensory diet we are trying to giving in morning, they can at least do it evening. So that his senses will get calmed down and the kid will be able to behave himself. And we have other thing called introception. So most of my kids will complain that parents will complain that my kid is not doing potty training. I would suggest every parent to start potty training at a very early age. See, once the kid grows beyond 4 or 5 years, it's very difficult for him to introduce a bathroom or something. Because and never ever force your kid or lock your kid in the bathrooms if he is doing something bad. And again, that gives a very negative impact. So especially with special kids, it gives a very negative impact. Once you do something negative, they'll remember it for the entire life. It will give a trauma to them. So never ever do like that. If you have done like that, it's very hard for them to do potty training. So for doing potty training, I have like given a lot of tips to my parents. Like you can just place ducklings with sounds in the bathtub or in the bathroom. You can just place soaps which give good scents, so that while rubbing her hands it will be like a playful thing. And never ever expect you to kid to directly sit on the ring or like on the commode. So make sure that your kid just enters into the bathroom, he does potty or he does like toilet. So first your kid should be comfortable in the bathroom, then you can ask him to go on to the like on the ring or in the commode, because your goal should be like introducing in the bathroom. So once it comes, he should be able to tell. If the kid is verbal, you can ask him to say susu or like toilet, whatever the term which is like taught him by the speech therapist, or even you can teach him, or you can just ask him to show the symbols, one or two. Even if the kid is non-verbal, you can just show him visual cues which should be placed at the outside of your bathroom. You should place different symbols, one for the potty, one for the toilet. So whenever he is feeling some sensation, like even if he doesn't feel also, you can just give him water, like half a liter or like depending on the age of your kid, and make him like go for the washroom and ask him to show for every 1 hour. Like for every 1 hour, if you make him to show that, and then like if you ask him to go for bathroom, then definitely within a month or two the kid will be able to show those visual cues and he'll go for bathroom. Or if the kid is verbal, he'll just tell you. Or you can just teach him symbols. Even if the kid is not learning both, you can just teach them symbols. See, because why I like emphasize more on potty training is, my parents will ask like, my kid wants to go to school. The first question I'll ask is whether his kid is showing like, can he go for washroom, like if he is feeling it. Even school people will also ask like if your kid is able to tell when he wants to go for potty or like washroom. So what I would tell, like we can't tell anything to them, right? Right. So for that, we should like practice this like every day, so that your kid will go for potty training. You should never leave that your kid is not going for potty training. And it is very difficult for us as a therapist to work in like in the branch for potty training. It's the responsibility of the parents to teach them potty training. We can do, but up to some extent only. I mean, like you can remove the diapers. You can just make them feel that sensation. Even the is short or anything is getting wet, let it get wet. You don't feel awkward about it. Make sure that your kid is learning that he is going for potty or like toilet. Outside it's like awkward, but within home you remove the diapers. You just spend some amount of time. If he is wetting himself, he'll understand that I am doing something bad, or like if it is getting wet, the kid will not feel good. So he'll remove that, or like he'll understand that I should go to the bathroom. So remove the diapers, do this process, then it will definitely do that potty training, and he'll be able to show the symbols or like the gesture or like the visual cues. You can use any of these things to do potty training. And there is something called as gustatory, which is called as oral stims. As I told, like a lot of kids will know, and most of the parents these days are asking, my kid is not eating particular fruit. So I would say there is a lot of difference between sensitivity and picky eating. Sensitivity means kid is avoiding hot foods or cold foods. He can avoid ice cream, or he can avoid hot food like rice. So some of my parents tell me that my kid is not eating guava or not eating apple. So that doesn't really come under sensitivity, it comes under picky eating. So me as a kid, even I don't like certain foods. Even now I can't eat certain vegetables. So that's called as picky eating. So don't get confused that your kid is not eating something and you never ever force. See, we can make the kid do anything except for feeding. We can force the kid, but we can't literally force him so that he'll eat entire thing. So it would be better you'd understand that whether it is sensitivity or picky eating. You can just like ask your occupational therapist to determine that. So if your occupational therapist wants to determine whether it is sensitivity, he can check with hot and cold tubes, and you can place it in this like in the gum area or teeth area. He'll just check with it. According to that, he'll understand whether he is having hot or cold sensitivity, or whether he is having normal picky eating. So you just confirm it with your occupational therapist. And for reducing certain behaviors, I would say most of the behaviors comes from sensory. So OT, and most of the parents ask me why BT. Like while the comfort assessment, they'll ask me why we should take behavioral therapy. So OT and BT are entirely different things, but there are certain common goals like eye-hand coordination or name calling. We do, and even if I work on sensory things, like I'll reduce the sensory input, but the kid is behaving in a different way. So the job of the the responsibility of the behavioral therapist would be to replace that behaviors or reduce that behaviors, so that the kid is socially acceptable. So most of the parents will tell only OT is sufficient, so my kid doesn't need BT. I would suggest you take both. If you take it for like 6 months to 1 year, definitely your kid will be able to progress in life and he will be able to go to school. So like most of the parents will ask me like, why behavioral therapy? So they'll work on behaviors, and most of the parents ask me like, they're sitting idle, they're just putting headphones or something like that. See, I'll get them make do activity. Okay, activity doesn't. It's like like say there is puzzle solving. Okay, in puzzle solving, what will come? In puzzle solving, the kid will be able to solve the puzzle. Okay, his cognitive levels will get improved, his attention span get improved. Or if I am making him do transport puzzle, in that he'll learn about the transport systems or about the vehicles in it. Nothing more than that. So if I really work on aggressive behavior and if I make him do the activity, what's the point of doing the activity? Rather than activity, there is something more which the behavioral therapists do. They make the kid sit idle so that they'll understand. During idle time only the kid will be able to show his true behaviors. So during activity he will really not show whatever he is feeling or whatever he is trying to do. So they'll make them sit idle and they'll work on this behavior. So most of the parents will ask why my therapist is not working on it. You can just ask the therapist there and then itself, because as your people are paying for Pinnacle or for your kid, you have every right to ask the therapist what you are trying to do. So instead of stopping the therapy or something like that, you can just contact with the therapist like what are you working on. So it's not like doing activity every time doesn't improve your kid's behavior. There are lot of things rather than these activities and all, which like a good behavioral therapist will do. And talking about stimming, there are different kinds of stims for every kids. So for that we need to understand why the kid does stimming, so which I have explained in it. And there are different types of stims which the kid does, and there is something called as fidgeting. In my experience, I have seen certain kids who still does fidgeting, but not that extent. The parent should be able to focus on the kids. So whenever he is trying to do, because I have observed a kid who comes to me who does hand clapping when he sees a bright light. So I try to reduce that behavior by doing dark room activities, and I made him do inverted head activity. So as the behavioral therapist will teach him the replacing behavior, like as I said, if he is doing hand clapping, if he does at the behavioral therapist, definitely she can work on it. But if the kid is not doing with the therapist, like whoever the therapist they're working, the parent should observe at home, whenever they have time, they should be able to address those issues. Like whenever the kid is doing hand clapping, just give him a ball. Whenever you observe, I'm not saying you to be behind of the kid, but whenever you observe that, you just give him the ball. So once you teach that, the kid will definitely stop that behavior and he'll be able to replace that behavior which is socially acceptable, like pressing a ball or like putting hands in his pocket. So
I would add upon these points as well, as Pushpak have explained about behavior therapies. So as a behavior therapist, I would give advice or suggestions that we work at least for 3 to 6 months, then we see the changes in the kids. So parents come and ask in 1 month, our kid is not stopping crying, or the stubbornness is not reducing in the kids, the hand clapping or anything is not reducing. So it will take at least 1 month for a therapist to understand the behavioral issues, why they are coming. So from the next month they start working. So it will take 3 months for a minimum change in the kid. So at the same time, the parents also have to focus on the kid. They have to note down the points or the timings when they are flapping, or even Pushpak told about the potty training or toilet training as well. So initially, if you start noting down when the kid is passing the urine, you can take directly to the washroom and make him stand. So that okay, so this is the place. You have to introduce the concept. Eating or even washrooms, when we introduce the concept, because the concepts are new to the kid, so if we introduce the concept only, they'll get to know. without introducing the concept, if we just directly ask them to do that, they'll not get it. So first we have to introduce and then we can see the changes. So we have two questions.
Yeah.
We have this question that so the kids touch the threads, so they touch the hairs as well. So how can we reduce that?
We can ask the kids, like we can ask the parents to give some fidget toys, like whatever, like I said in like Amazon or Flipkart. So instead of touching with threads, we can ask them to, like we can use pop it toy, like there is something which improves their eye contact as well as their attention concentration. Along with that, we can use something called as a ball, like with fidget ball. So there will be threads for it. So there is something called as push balls, which will have threads to that ball. So if you give that ball, the kid will stop playing with these threads. Instead of that, he'll get adapted to these push balls. Definitely it will take time, but he playing with normal threads rather than he'll play with these push balls, which is like a normal, it will look like a toy rather than playing with threads and like chargers. He can play with the push balls, which is like a good thing. Even if someone sees also, it won't look awkward. They'll think the kid is playing with a ball.
So there is one more question. So does all the kids who are touching the ropes have this habit of touching the hairs?
I think so. Yeah, one of my parent has complained that like the kid is sitting on like on the bike behind her and he's touching his hair, which is called as hair twirling, which they do. So even for them, we can just give this replace with that toy. So not on the bike, but rest of the time whenever he is touching, we can just give that push balls and like or like that pop it toy, and we can just divert this behavior. We can't completely reduce any behavior. We can just suppress it to some extent, like whatever I said, like 90%. The rest can be like like sometimes if it is, that's fine. Like you should observe. So most of my parents will tell like it's not completely reducing. I wouldn't say completely reduce. It can reduce up to some extent. Like if your kid is doing 10 times a day before giving therapy, you can observe a lot of change. Your kid will do only 2 times. So the frequency has reduced. So that's the like maximum extent a therapist can work on. Like we can't every time control the kid. So you can just replace with something which is socially acceptable.
So there is one more question that will nail biting come under stimming, and how can we reduce it?
Yeah, most of the kids do out of frustration or to pass their time. So we can just give nail paint, which is very bitter. We can try with that, which can reduce that like nail biting and all. Never ever hurt your kids. Like the most important thing which I like to conclude in this session is never ever punish your kids when a kid is visiting or when a kid is doing stimming behaviors. See, if you hurt your kid or say no, it will give a very negative impact and he'll try to do it more. So instead of that, replace it with positive reinforcement, and when he stops that behavior, give him a positive reward, so that your kid will be, you should understand that your kid is special, and as society is doing nothing for him, you are the one who is taking care of him. Like don't think about society, think about your kid and make sure that your kid is like a normal kid, and accept the fact and move on with it. And that's like the behavior that we should work on that, and like never expect your kid's behavior will entirely come down. It can be reduced to only some extent only. In my experience, like in my 2 to 3 years experience, what I have understood is he'll do visiting, but the frequency will get reduced. It won't be like he'll completely stop visiting. You can go through any articles. There are a lot of Google's, like Google, you can go into Google Scholar, you can type about visiting or hand stimming, and if any of the parent will come and tell me that this visiting gets entirely reduced, I'll definitely accept that visiting gets reduced. So I mean, like I would like to say that accept your kid like a special kid. Make sure he is a normal kid. Like don't expect him to normal kid. He has a different talent rather than normal kids. Thank you.
So I would add upon this, saying repeatedly no to the kids may turn them into stubborn behaviors as well. So they might be thinking, okay, whatever I say, so it's a no. So if I start crying or if I show any tantrums, I'll get that thing. So that behavior will be adapted by the kids. So instead of saying no, you can take some time, invest your time on the kid and see what the kid is exactly doing at that moment, and sit with the kid and you give him the time and then you can again ask him for the thing which you want.
Pinnacle Blooms Network ప్రపంచ వ్యాప్తంగా స్పీచ్ డిలే, ఆటిజం స్పెక్ట్రమ్ డిజార్డర్, కాగ్నిటివ్ డెవలప్మెంటల్, సైకలాజికల్ రుగ్మతలతో బాధపడుతున్న దాదాపు 80 కోట్ల మంది పిల్లలు మరియు పెద్దల జీవిత ప్రమాణాలు మెరుగయ్యే విధంగా దశాబ్దాల రీసెర్చ్ తో కూడినటువంటి అత్యంత ప్రభావవంతమైన స్పీచ్ థెరపీ, ఆక్యుపేషనల్ థెరపీ, బిహేవియరల్ థెరపీ, సైకలాజికల్ కౌన్సిలింగ్, చైల్డ్ డెవలప్మెంట్ మరియు రీహాబిలిటేషన్ సర్వీసులు అందిస్తున్న ఏకైక స్పెషల్ ఎడ్యు హెల్త్ కేర్ సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. ప్రపంచంలోనే మొట్టమొదటిసారిగా మిరాకిల్ అనే పేటెంటెడ్ టెక్నాలజీ సహాయంతో అత్యంత పారదర్శక థెరపీ సర్వీసులను అందిస్తున్న ఏకైక సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. 100 మందికి పైగా నిష్ణాతులైన థెరపిస్టులతో మీ మరియు మీ పిల్లల బంగారు భవిష్యత్తు కొరకు పాటుపడుతున్న సంస్థ పినాకిల్ బ్లూమ్స్ నెట్వర్క్. భారత ప్రభుత్వ ప్రతిష్టాత్మక స్టార్టప్ ఇండియా అవార్డు పొందిన భారత్ హెల్త్ కేర్ ప్రైవేట్ లిమిటెడ్ యొక్క అనుబంధ సంస్థ.